Hi, my name is Alex Stockdale. I'm a lecturer in infectious diseases and I was working in Malawi for 3 years in the Malawi Liverpool Wellcome Trust and as a consultant physician at the Queen Elizabeth Central Hospital in Blantyre. I'm going to be sharing with you the results today of our cross-sectional community census-based serologic survey of a township in Blantyre in Ndriande. So in terms of an epidemiological assessment of hepatitis C prevalence, there's different ways to try and make an estimate of the prevalence within the community. Clearly, we're interested in high-risk groups, such as people who inject drugs, men who have sex with men, and commercial sex workers. But in terms of looking at the community prevalence, often surrogate groups that are quite easy to access, such as antenatal, pregnant women, blood donors, and occupational groups are often used as surrogates for the community prevalence. But in this study, we aim to get an assessment of the community prevalence within the general population. It's also important to look at the prevalence within in patients with disease to get an assessment of the impact of the virus within patients who've got established liver disease. But today I'm going to report the findings from our community prevalence survey. So the aim of this study is to describe the community seroprevalence for hepatitis C in Blantyre and to look at the molecular epidemiology of hepatitis C within the southern region. So this is a map of Malawi. We're in the southeast of Africa. I'm sure many of you know Malawi well. Zambia to the west and surrounded by Mozambique and Tanzania. And if we look at the southern region of Malawi, there's Blantyre in the center and Blantyre city. There in the northeast corner of Blantyre is Ndriande, which is a large township, quite densely populated. And this is a picture from the hill overlooking Blantyre showing what the township looks like. So as part of a study looking at typhoid seroepidemiology, a census was conducted of the township, revealing around 100,000 individuals residing there. This was followed by a serologic survey using a single stage random probability sampling from the census list. We then tested among individuals in the Serosurvey for hepatitis C using a combined antigen and antibody laboratory ELISA. The advantage of adding the 4th generation antigen test is it improves detection of individuals recently infected relative to antibody testing alone. And we confirmed those who were positive by ELISA using HCV RNA PCR using the Gene Expert. The molecular epidemiological aspect of this study was to test those that were viremic for hepatitis C from the Serosurvey and also in patients with cirrhosis or HCC who had been prospectively recruited from the Queen Elizabeth Central Hospital, which is a tertiary referral hospital for the southern region of Malawi. So sequencing was conducted in Glasgow, the University of Glasgow Centre for Virus Research. We used capture target enrichment with bioethylated probes and sequence using a next generation sequencing platform from Illumina and aligned reads to subtype specific reference sequences using a bioinformatic pipeline from Glasgow. So in total from the census population of 100,000 individuals, we sampled 1,661 aged over 16 years. And the median age of the sample was 30 years and 52% female. And this just shows the relationship between the census population in green and orange and the Serosurvey population in the lighter colors of blue and pink. And it shows that there's a close match between the population distribution of the census and the Serosurvey. So our accrued prevalence among the individuals was 13, which is 0.8%, which is the same in men and women. Population standardized prevalence was not different because it closely matched the census distribution. So the overall estimate was 0.8% by antigen antibody testing. And when we looked at confirmed HCV RNA positive patients, the prevalence in the community was 0.2%. So quite a low prevalence with 95% confidence between 0.02 and 0.4. Now, if we look at those who are positive, the 13 patients along the x-axis who are positive by antigen antibody testing, and we can see the 3 individuals, they were all tested in duplicate or triplicate, and you can see the 3 individuals that were HCV RNA positive had a much higher sample to cutoff ratio in the ELISA test indicating that potentially the S to CO could be increased, as other authors have previously described, because most of the low-level positives were negative by RNA PCR. Now, if we look at the molecular epidemiology, this is the results of the sequencing of the hepatitis C samples. We can see that among the community samples, one was for subgenotypes as 4R, and the other two is 4V, and a similar picture among the inpatient samples, 4R, 4V, 4W, predominating. All of our samples were genotype 4, and it's interesting to see endemic 4R in Malawi. This has not been previously described. This has previously been identified, particularly in East and Central Africa, and in previous data from Rwanda, 4R was associated with treatment failure when using sofosbuvir, ladipasvir. So overall, to conclude, this was the first representative general population survey that we were able to identify in the published literature in Southern Africa. There was a very low rate of HCV in terms of confirmed viremic infections at 0.2%, and that compares to slightly higher estimates from modeling data based on predominantly surrogate samples of around 1%. There was a high rate of false positives when we talk in terms of confirming antigen antibody tests with PCR, showing an overall low specificity of the ELISA antibody antigen tests, and perhaps the role of using the sample to cutoff to identify those that are more likely to be true positives. And finally, we found that the genotype circulating in Malawi is genotype 4, and that there was a suggestion of endemic 4R, which has previously been found in other samples to have low rates of SVR when using sofosbuvir ladipasvir. So I'd like to thank you very much, and I'd like to acknowledge my many colleagues who've collaborated with me on this project.